Good evening to all. Myself, Dr. Nilofer Sheikh, Associate Professor and Gynec Consultant at JS Ayurved Mahavidyalay, PD Patel Ayurved Hospital, Nadiyad, Gujarat, India. So, today I am going to discuss about the Leucorrhea and its Ayurvedic approach. So, Leucorrhea, it is a common gynecological disease that we can find during our day-to-day practice. So here leucorrhea, that is the normal vaginal discharge. It is quite often frequently met in the day-to-day gynecological practice, and one study in India has shown that the prevalence of reproductive tract infections was 37% based on the symptoms, and according to the laboratory investigation it is about 36.2%. Including the 31% candidiasis, it means the fungal infection, 3% gonorrhea, 2% trichomoniasis, and 45% of bacterial vaginosis. So these are the prevalence of these bacterial infections specifically to the reproductive tract. Then what is leucorrhea? So leucorrhea, it is a white discharge from the vagina. Basically, there are two types of vaginal discharge, physiological discharge as well as pathological discharge. Normally, vaginal discharge occurs during the period of ovulation, that means the mid-cycle, then before and after the onset of the menses, and during the pregnancy. During the pregnancy also there will be the increased amount of vaginal discharge. But there is no any associated complaint like the itching, burning sensation, etc. And during the period of lactation, menopause, the discharge will decrease. So this is the physiological vaginal discharge. And here in a physiological excess of vaginal discharge, there is no any requirement of the treatment or the management. But if it is the pathological one, then only we have to treat these conditions like candidiasis, trichomonas, gram-negative, gram-positive bacterial infections, etc. Now coming to the Ayurvedic concept of the leucorrhea during leucorrhea. So in Ayurveda, as such, there is no any descriptions regarding the leucorrhea. We can correlate it with the Swet Pradara. But again, in the Bruhatrayi, there is no any reference of Swet Pradara. But Acharya Chakrapani has explained the word Pandura Asrugdara as a Swet Pradara in his commentary. So basically Pandura Pradara it is Swet Pradara. That is explained by the Acharya Chakrapani. And the word Shwet Pradar, that has been firstly quoted by the Vrind Madhav. So there are many other diseases in which Shwet Pradar is described as a symptoms like Parisruta Jathani, Asthisrava, Shomarog, Kafaj Yoni Vyapad, Kafaj Asrugdar, वातज योनि व्यापद, पित्तल योनि व्यापद, श्लेष्मला योनि व्यापद, सन्निपातिकी, अचारणा योनि व्यापद, अत्यानंदा योनि व्यापद, अतिचारणा योनि व्यापद, उपप्लुता योनि व्यापद, परिप्लुता, and the falini. So these are the conditions where as a symptom white discharge or the leucorrhea has been mentioned. Now coming to the local pathological conditions which are producing the Swet Pradar. Basically, Swet Pradar literally means the white discharge. In the medical conditions, discharge can be profuse, sometimes grey or whitish in color, yellow or green in color, brown color if it is mixed with the blood, and sometimes it is associated with the itching vulva, specifically in cases of fungal infection. In Ayurveda, there are some conditions which we can correlate with this type of the infections. First one, there is the Acharna Yoni Vyapad. So in Acharya Charak has explained this Yoni-Vyapad very well. Yonyam adhaunat kandum jata kurvanti jantavaha. So basically the cause of Achana Yoni-Vyapad is unhygienic condition, and that's why it creates the itching in the vagina. So in this condition we have to advise the patient to maintain the local hygienic condition, as well as some sthanik chikitsa will be beneficial. Second Yoni-Vyapad, that is Paripluta Yoni-Vyapad. Again Paripluta Yoni-Vyapad, it is the very similar condition of the chronic infection or chronic infection of the genital tract, because all the features of the Paripluta Yoni-Vyapad is suggestive of the pelvic inflammatory disease, that is the PID. So in acute inflammation of the genital organs, all the clinical features described by the Charak and the Shushruta may be noted, and this one can be correlated by the colonic irritation caused by the pelvic hyperemia, like diarrhea. This is the symptom which can be appear in cases of PID. Okay. So Vagbhat, according to Vagbhat also, the symptom, that is diarrhea, is mentioned in condition of Paripluta Yoni-Vyapad. And Vataj and Pittaj, Vat and Pitta, these doshas are responsible for this condition, and they produce the features like the Shuna, Sparsha Asahatva, Basti, Kukshi, Gurutva, Jwar, that is fever. So in cases of PID, fever is there. So the most important feature, that is dyspareunia, and it is explained by the Acharya Shushruta like Gramya Dharme Ruja Vrisham. So in condition of Paripluta Yoni-Vyapad or the pelvic inflammatory disease, this dyspareunia is there. As the disease is caused by the coitus, hence it could be a condition of acute inflammatory stage of the gonococcal infection and the chronic salpingio-oophoritis. So with this we can correlate the Paripluta as a condition of pelvic inflammatory disease. Now coming to practical aspect of the Leucorrhea and its management. So basically when patient approach to us, they may have the complaint of white discharge associated with itching or without itching. If itching is there, then it can be due to the fungal infection. Then we have to perform the pars speculum examination. If curdy discharge is there, then it is suggested the fungal infection. So basically curdy discharge associated with itching, that indicate the candida infection. Profuse white discharge can be because of the bacterial vaginosis or the trichomonas infection. If the discharge is associated with the bleeding, or if it is brownish or the reddish in color, then it can be because of the carcinoma of the cervix or the cervical erosion. If a white discharge is associated with fever and the pelvic abdominal pain or pelvic pain, then it is because of the pelvic inflammatory disease. And if a patient has the redness and the burning sensation associated with this white discharge, it may be because of this vaginitis, specifically the senile vaginitis. Now, when patient has the complaint of the white discharge per vaginal, then first we have to do the pars speculum and per vaginal examination in unmarried patient. In married patient, here unmarried girls, in the unmarried girls we can't perform the pars speculum or per vaginal examination. Then we just inspect the lower genital tract and we can give the medicine. But if patient is sexually active and married, then we have to perform the pars speculum and per vaginal examination. So in per vaginal and pars speculum examination, the various causes of white discharge that we can found, like cervicitis, that is the inflammation of the cervix, cervical erosion, or vaginitis. So according to the cause, we have to manage, and we can see the type of the discharge also, like either it is a curdy discharge or the pure white discharge or reddish or blackish discharge. Even we can find the carcinoma of the cervix in the early stage with the perspeculum examination. Now after the examination, the investigation protocol, like there are some investigation that is to be advised to the patient. The first and foremost investigation, that is the pap test. If cervicitis is there, profuse white discharge is there, if patient has the chronic history of white discharge or recurrent white discharge, then first we have to do pap test. It is a OPD based procedure, and with this pap test we can early find out the cases of carcinoma or the cervical intraepithelial lesion, or that is a CIN cases. So pap test is must. Second, CBC. If patient has the fever with white discharge, then CBC is must. Second thing, in cases of white discharge with young age group, like if unmarried patients or the in adolescence age group patient has the white discharge, then CBC is must to find out the hemoglobin percentage, because lack of hemoglobin or low hemoglobin is also one of the cause of white discharge, and we have to treat this low hemoglobin and then patient cured. Then second, third investigation, that is the fasting blood sugar. Again, FBS is indicated in cases of chronic white discharge and when the patient has the history of diabetes, because in patient associated with diabetes mellitus, then again they have the recurrent white discharge. Now coming to management. So basically two type of management is indicated in cases of white discharge. One is oral medicines and second one is some local therapies. So in oral medicines, there are some common yogas which we are frequently using in our OPD to treat the white discharge, that is Leucorrhea. So first, that is Pushyanug Churna. It is a wonderful drug to treat the Leucorrhea, and the dose is 3 gram 3 times, and the Anupan is Tandulodak, that is the rice water. So Pushyanug Churna. Second one, Amalki Churna with Madhu, that is honey. Nagakesar Churna 1 gram, Chopachini Churna 1 gram, and the Gandhak Rasayan 500 mg. That can be given specifically in cases of fungal infection or the PID. Then if a patient has the burning micturition, then you can add Gokshur Churna, Lodra and the Haridra. Again, Haridra is also indicated in cases of carcinoma cervix. Haridra, Amalki, Guruji and the Gokshur. It is the line of treatment in cases of CIN. Like it helps in regeneration of the epithelium of the cervix. Then Chandra Prabhavati, that is the tablet. 2 tablets 3 times a day with water. Rasayan Kalpavati. Again, Rasayan Kalpavati is indicated in cases of cervicitis, cervical erosion, when we need the re-epithelialization of the cervix. Then you can give Rasayan Kalpavati. Here, Rasayan Kalpavati is the combination of Guruji, Gokshur and the Amalki. Then Dhatri Loha, Punarnava Mandur in cases of low hemoglobin. In a quath or decoction, we can give a Punarnava quath, then a Nimb quath orally. Shatavari Churna is indicated in cases of senile vaginitis. When patient has the complaint of white discharge, dryness of the vagina in the old age, specifically in menopause, then you can add Shatavari Churna, Shatavari Grut orally. Panchatikta Grut can be given in cases of chronic PID, pelvic inflammatory disease. Now coming to local therapy. So again in local therapy, frequently we are using the Yoni Prakshalan and the Yoni Pichu. That is the it is a cleaning process of the local genital tract. Yoni Prakshalan, there are various decoction that we can use in procedure of Yoni Prakshalan, like a Panchvalkal Kwath, Nimb Kwath, Trifla Kwath and the Udumbar Kwath. So Nimb Kwath, basically it is very helpful in cases of fungal infection. If there is dominancy of cough, then you can use the Trifla Kwath or the Panchvalkal Kwath. If the aggravation of Pitta is there, like a patient has the complaint of burning sensation in the vagina, then Udumbar Kwath is indicated. So these are the decoction that we can use in process of Yoni Prakshalan. After the procedure of Yoni Prakshalan, Yoni Pichu is indicated. So Yoni Pichu, for Yoni Pichu, Jatyadi Tel, Nimb Tel and Shatavari Grit. Local application of Shatavari Grit is also useful in cases of senile vaginitis. So here the line of treatment is depend upon the cause of the white discharge, age of the patient and any pathology of local pathology, like if cervical erosion is there, then but obviously we have to do the Kshar Karma or the Agni Karma first, then after we can treat this white discharge or leucorrhea. So this is all about the management of leucorrhea, Ayurvedic management of leucorrhea and its Ayurvedic approach. Now I think that is enough for today, and with this note here I like to end the session. And once again here I like to thank Indo-Nepal Ayurveda Cooperation Campaign for providing such a wonderful opportunity to share my views on this platform. Thank you so much.